Well, a warm welcome to this talk, Monday the 19th of December. Now, today I want to share with you my experience of using the yellow card scheme because I've reported a potential side effect of the vaccination in me. But we'll talk about that in a minute. Now, I've had an awful lot of feedback on this. Incredible amount of feedback on this. Now, this is Mr. Andrew Bridgen MP, and this is the junior health minister, Maria Coldfeld, not the Secretary of State. He didn't bother to turn up. Now, this is the UK Parliament debate on vaccine injury, an adjournment debate. And as you'll see from the state of the benches, our highly qualified, highly paid members of Parliament, most of them didn't bother to turn up. So she's got to be there. Maria Coldfeld's got to be there. She represents the government. As I say, she is not the Secretary of State. She's a junior minister. No disrespect, a junior minister's still a senior post. But why wasn't the Secretary of State there? We are dealing with the biggest health intervention in the United Kingdom ever, the implementation of the COVID-19 vaccination programme. This is the biggest intervention we've ever had in the United Kingdom that I can think of. And there's a debate by a member of Parliament who's citing a lot of evidence, who's saying, well, just a minute, I'm a bit unhappy about this, there's some things to discuss. And who bothers turning up to listen? It really is quite appalling, and many of you have said this as well. And to be quite honest, this is a national disgrace. It's an embarrassment to the United Kingdom. And the UK Parliament has done itself no good whatsoever in this. It's made itself out to look really apathetic to the health of its people. I mean, just look at this. The opposition benches, one gentleman over here, all the rest, SNP benches here, empty. Labour benches here, empty. Most of the Conservative benches here, well, 1, 2, 3, 4 people there. I mean, this really is an indictment on the UK Parliament that this has happened. And I hope if parliamentary representatives are watching, they feel duly indicted by this, because I just feel this is incredible. This level of apathy. What is going on here? Is it apathy? Is it something else? You know as much as I do. Absolutely incredible. And then lots of people also pointed out that Madam Speaker here, Madam Deputy Speaker, and again, this is not the Speaker, well, she had been on all day, but it's not the main Speaker, she's a Deputy Speaker. And she was having a chinwag. I mean, this is the Madam Deputy Speaker here. This bloke here is like a clerk or a lawyer, he's got to be there. She's having a good old chinwag with this woman here, I don't know who it is. But during this really important speech from Mr. Andrew Bridgen, she gave all the impression to me of not listening. Now, if that had been one of my lectures, I would have said, just a minute, if you don't want to be here, go away. Of course, she's got to be there. But she didn't even have the politeness to give Mr. Bridgen her full attention. This has put the UK Parliament in a very bad light indeed. I really think it is a national disgrace. There we go. That's what MPs think of the possibility of a potential risk to health in the UK. They simply didn't bother to turn up. As you can probably tell, I'm not very happy about it. Now, my last COVID vaccine personally was in November 2021, and I started taking blood pressure meds in March 2022. And I don't take my blood pressure that often, tend to take it every 3 months, every 6 months. But when I took it in January, it had been going up and kept an eye on it, and it had gone up really quite all of a sudden, really. Having had pretty low blood pressure all my life, especially my diastolic blood pressure has always been really quite low. About a couple of years ago, it was like 60, 65. It was really quite good. And my diastolic blood pressure has actually gone up quite a lot, and my systolic blood pressure went up quite a bit as well. So I've had to start taking blood pressure medicines. Not ideal, but that's what I need to keep my blood pressure under control, because if you don't keep your blood pressure under control, you get all sorts of complications, as I'm sure you're well aware. And the thing is with high blood pressure as well, you don't really get many symptoms. You can only tell by taking your blood pressure, but all the time it can be damaging your blood vessels, your heart, your blood vessels to your brain, your kidneys, your circulation. The quality and integrity of the entire arterial vascular system, in fact. So I've decided And I don't know why I didn't do this before. Just before I launch into what I'm about to tell you. This is from Don't Wait for Someone Else to Report It. And this is from an official government publication, Medicines and Healthcare Products Regulatory Authority. And they say this, the yellow card scheme where we report our adverse events, it is estimated that only 10% of serious reactions, so that's 10% of serious reactions, in other words, 90% of serious reactions probably go unreported. This is to any drug. This is pre-COVID. This is not necessarily about vaccines. And 2 to 4% of other more minor adverse reactions go unreported. So that means that about 96 to 98% go unreported. Now, I've been whinging about this for a while, and then I realised that I haven't reported my own what I considered to be a temporal correlation. Did my COVID vaccinations, I had 3, did they put my blood pressure up? Whether the cause of that, don't know. Is there a temporal correlation? Yeah, there's a temporal correlation. So I decided to report it. Now, I'm just going to go through my experience in doing this. And just before we start, I will say that it's actually quite positive. So you go onto this site, yellow card reporting system. Now, of course, in the old days, this was literally yellow cards. Now, of course, it's all computerized. So I put in COVID vaccines, got no match there. Put in COVID vaccine, can't find a match for your product there. Pfizer COVID vaccines, no match there. Moderna, no match there. But when I actually got into it, I did actually find it was quite good. So little difficulty getting started, but after that, it was actually really quite a good site, and I was able to report. So you just go through, you put in information about you, obviously a lot more information there about yourself. Just takes a few minutes to fill out. Once I got past that initial hurdle, it worked quite well. Now, you can report as a member of the public, or you can report as a healthcare professional. As a member of the public, you can report about a child, for example, or an elderly person, or you can report about yourself. This is free for anyone to do. So I reported entirely as a member of the public, not in any professional capacity at all. Purely as a member of the public, purely about me. And it worked very well. There you go, John Campbell, a member of the public, as opposed to a healthcare professional in this situation. Then put in a few details. This is medicines and medical devices. Yeah, that's just saying what it's doing, isn't it? So there you go. Put information about me. And then you put in about your the vaccines that I had. So that was that must have been the first one. That'll have been the 18th of February 2021. That was the first one. And then you say what it's for, COVID-19 prophylaxis. Then I had Moderna. That was Moderna was actually my booster dose. So I had the Moderna. The Moderna one I had on the 20th of November 2021, over a year ago now. 13 months ago now, since my last vaccine. Then please tell us about the vaccine. Yeah, so it's fairly intuitive. You put that information in. Yeah, that was the last one there. So 20th of the 11th, 2021. And then you add about your reaction, or what you think is your reaction, that could have been potentially caused by the vaccines. And again, hypertension actually came up. So you type in a few letters and that came up. So that was all fine. That became aware of that in January. That was pretty straightforward. Then it's how serious it was. So you've got not serious to life-threatening. And in my case, significant enough to lead you to seek advice from a healthcare professional. So obviously I had to get the doctor to prescribe my GP to prescribe my blood pressure meds. And then other medical history. So at the time I was taking atorvastatin for cholesterol. And to put that in. And please enter COVID-19 vaccine. Oh, that's right. Please, COVID-19 status as it was. So have you as the patient are reporting or had symptoms of COVID-19? So I had a chronic cough in 2020. That could well have been that. I don't know, but we didn't have testing then. So simply, I don't know. I've never actually tested positive. So symptoms, but didn't have a positive test. And then anyway, there you go. It actually worked out well, and the report was submitted. So just bear this in mind, that if you have had adverse reactions, it is a very straightforward matter to report it. But GPs aren't reporting it enough, practice nurses aren't reporting it enough, nurse practitioners aren't reporting it enough, because we've got massive underreporting, and that is from the latest MHRA site themselves, from the government site themselves. So what I've done really is report a temporal correlation. Now, it may be that I was developing high blood pressure then anyway. I have no idea, and the vaccine could have been coincidental. But the point is, if hundreds and thousands of people do it, or tens of thousands of people do it, then you start to develop a trend. This is why we need to do this. So if you suspect you've had an adverse reaction to any medication, that's what the yellow card scheme is for. Put it in, and then you start collecting data, and then safety signals can arise out of that. Now, I've got quite a lot of detailed information on the yellow card latest report. I think I'll do that in the next video, though, because otherwise you get a bit bored. So for now, thank you for watching.